Let's head over to the KU News Zoom room. Patiently waiting, we have our state epidemiologist, Dr. Ann Pobutsky, and the contact tracing lead, Annette Huggan, out of Public Health. Good morning, ladies.
Good morning.
Good morning.
And I know we're, first of all, I apologize for going to you guys so late. I know we're backed up on time, so we just want to start with Annette. And Annette, if you could, maybe give us a little bit of behind the numbers, the testing that we've done throughout the week. How much of it was from contact tracing? How much of it was from new positives? If you could, Annette. And good morning, by the way.
Oh, good morning. Well, the one positive thing I can say is that compared to last week, our number of new positives have gone down, which is a great sign. Just comparing the sit reps from last week and last Thursday to this Thursday, we're seeing a less 134 difference. So we have less positives reported this past 7 days. However, we have seen with the cases reported throughout this week, majority is from household contacts, and then the next group is from the work contacts. And again, we keep hearing the same thing of, someone was sick or they didn't realize they were sick. They brought it to their home, or they went to work, and unknowingly spread it amongst themselves. And so we hope to continue to see this downward trend. Again, it's we're not out of the woods. Again, the hospitalization numbers is what's still alarming and very concerning. But we hope to continue to see it go down. As expected, our positive cases reported this past week are mainly from the north. And we've also seen an increase for villages in the central part of Guam. And so again, the disease has no border, has no discrimination. It's community widespread. But hopefully people will continue to social distance and, practice wearing their mask and, hand sanitizing, so we can continue to see the numbers go down, as we move forward.
Thank you, Annette.
Thank you. And now let's take it over to Dr. Anna Pobutsky here. Dr. Ann, good morning.
Morning.
And I saw you brought some charts.
We haven't seen a decrease in the deaths. We have not seen a decrease in the deaths. It's still going on, and there's always a lag time. Even though the cases, are decreasing, there's always a lag time. And, with the deaths, people don't just die immediately. Sometimes they take weeks. And so we're still seeing bad news with the death toll. And as Annette pointed out, the hospitals. I can't share my screen. Can I try and do that?
Yeah. Yes, of course, Dr. Ann. Jason is going to enable that. Okay.
Can you see it?
Yes. We got you.
Can you see that?
Yes,
Yes,
we
ma'am.
got you on, Doctor.
You stop.
You can see the graph.
Yes.
I just wanted to bring this up to say, this is what about the word pandemic don't people understand? If you look at 1918, this is Guam. This is the crude death rate for Guam. And you can see that giant peak there in 1918. That's the 1918 pandemic, influenza. And people seem to forget that this is a pandemic. This is not some joke. That's the crude death rate for Guam for all those years, 1902 to 2018. I haven't updated it. We are on course to have COVID deaths by the end of the year be in the top 10. I'm thinking it's probably going to be in the top 5 leading causes of death for Guam, the way it's going. And that's not good news.
Doc, I mean, we're just seeing the numbers between the first wave and this second wave, or I don't know if it was you that said this was just really a continuation of the first wave. Someone had said that. But what is the difference between what we saw then and what we're seeing now? Because you're right, the deaths, it's alarming. We had 4 in one day, just the other day, and they keep coming.
Right. Well, we only had 5 deaths in the first 5 months. Then beginning in August, the last 3 months, that's where the vast majority of the deaths have occurred during our surge. 5 deaths and 5 deaths up until July. We only had 5. That was concerning, and I see. Okay, somebody's put up this graph. Great.
That's Dr. Lombard. Dr. Lombard, can you not share your screen, or Jay's gonna take care of that? Okay.
Oh,
There you are. Hi, Dr. Ann.
Okay, we got you. Yeah, she's good. She's
No,
good.
it's great to see more and more data that
Right.
tells us bad news. What are we going to do about it? And we're a community here.
It looks like it's a report card on on Guam, and now
We're getting an F.
failing.
Yeah, definitely.
Well, have you seen the pictures from the hospitals? They're setting up beds outside on the curb and going to put up tents. You know,
Yeah.
that's what they did in 1918 all over the world because they couldn't fit people into the hospitals. Our hospital capacity is overwhelmed.
Doc,
So
when we spoke last week, you had talked about a new designation with the World Health Organization, and that designation you were going to file with them, and basically widespread community transmission.
community transmission.
Right. Yeah.
Right. Well, they're still discussing whether to put us in that designation. I guess they have criteria that they have to follow, but our assessment from here was that we are at stage 3 on the World Health Organization, whatever their schema is,
Right.
and they're discussing it. They, have criteria for that. So they're still discussing it. I haven't heard from them this week.
Dr.
But
Ann,
we suggested that, yes, we move from stage 2 to stage 3,
Dr. Ann,
from local transmission to widespread transmission.
Dr. Ann, what do you think about the implementation of these fines and penalties? Do you think it's going to help?
I don't know. I would hope so. I mean, how else are you going to get people to behave? In Australia, they require everybody to vote. And if you don't vote, you have to pay a fine. So everybody votes. Or even if they send in a blank form. So, it's something similar. It's like, you want to get fined $100 or $1,000 for breaking the rules? I don't know if those, suggestions are going to help. I do know in Hawaii, they had some trouble with implementation of some of the fines because it has to be sensible. Just because you're alone jogging on a road with nobody around you or in a park. I believe there was a case where somebody was walking through a park with their dog and wasn't wearing a mask, and they were outdoors and nobody was around them and they got fined. So it has to be implemented in a common sense way, and, being cited for having a large party where there's 50 people at your house versus walking along the road, or jogging, walking to the beach. So it has to be implemented sensibly.
Right.
At the same time, why aren't people following the rules? Again, we're back to, don't you know the meaning of the word pandemic? And we need to stop it. The transmission, we just need to stop it. The community needs to make sense. And we're coming into holiday season. And I know everybody, we've got All Souls Day, Halloween, we've got Thanksgiving, Christmas. Just forget it. It's a pandemic. This is not a normal situation. It's a novel coronavirus. It's new. We still don't know how it's going to play out. So people need to follow the rules and don't have parties. Forget it. Forget Christmas. Forget Thanksgiving. Just stick with your household and don't be mingling with large groups of people, and follow the rules till this is over. It's going to take another year, probably more. Sorry to bring be the harbinger of bad news,
No.
but that's the reality of a pandemic.
It's
The
Halloween.
influenza pandemic lasted 2 years and went up and down and up and down.
Yeah.
And it surged during the seasons. And now we're in influenza season. We're seeing influenza now. We had one death that had both influenza and COVID. So this is not a nice time for anybody.
Right. And Doc, when we get everybody on and they, the guys from the PAG, they talk about COVID fatigue. People are just tired. People are just tired. They're tired of staying home. Can you give a little
We're
context?
tired of it too.
Yeah.
Believe me,
I
public
know.
health is tired of it too.
Right.
Asking that. We've been working constantly. But the good news is we are starting to get a little more help. We've got the CDC deployment here. We've got hired some people through the CDC Foundation, which is fantastic. We've got some young, energetic people helping us with the data, with the contact tracing. We've got the Department of Labor, core workforce with the contact tracing. So we're getting more help. It's taken a long time to get to this point, but we're getting a little more help. We should have some more data soon that hopefully will help inform what we're trying to do. So there is some good news. Public health is getting more help.
Right. Yeah, Doc, but for the
Yes.
context, right, what I was trying to say was that we've got everyone saying there's COVID fatigue, but if you're saying that we're still a year out from the end of
Yes.
this, I mean, what would
At least.
what would your message to people be? Because I just feel like people are thinking that we're right around the corner.
No, sorry. Not with what we're seeing at the hospitals and the death toll, because I'm the one doing the mortality analysis right now, and I don't like what I'm seeing. It's very depressing to look through all of the case data, and I'm trying to clean up the data and trying to verify, because sometimes we just have the doctor's note till we get the death certificates, and it's not nice. It's bad. Deaths are bad, especially if it's excess deaths. Sorry, it's gonna have to hunker down for another year. I have a friend we normally have Thanksgiving together with her and her family, and it's like, it's not gonna happen. I'm not doing it. I'm too scared.
Wow. We had I don't know if Annette can answer this, but I had a question come in on the WhatsApp. Chris, can you ask public health? My mom is a cancer patient and was told on 10/21, October 21st, that she was COVID positive at GRMC. They sent her home and told her that someone from public health will call her. Up to this day, no one has called her, and it's disturbing her treatment for cancer. She's unable to get her cancer treatment until she gets clearance from public health. I tried calling the 311 number. They gave me 9 phone numbers. I called them, and only one person responded. Dr. Barb said she'll have someone call 2 days ago. Till now, nobody has called.
So that's very alarming to hear that. I would offer that she can call me at my office
Okay. I'm going to go ahead and give them your
when
number.
I'm done with this interview.
Okay.
If she can give my number, and then I can connect her with our isolation unit.
Right.
They are the ones who would coordinate checking in on the client, and also monitoring them throughout their period, just to make sure to also provide any wraparound services, to coordinate, especially for the information she's providing that her mom has cancer treatment, that we need to ensure that that's maintained and provided for her. And so, yeah, I would need more information, but yeah, that doesn't sound right. And we will definitely look into it. So yes, if you could please provide her my number, and I can assist her and get her connected to the right people.
Thank you.
Under our isolation unit.
Thank you. And I mean, this is something, I don't know if we've covered this, Bree, but so what is the protocol when you get COVID and you're, going through chemotherapy?
So that's something definitely, but again, for the medical physicians to work that out. There really isn't treatment for COVID right now.
Yeah.
It's more, for just supportive, and like fever and stuff. So it's depending on what her treatment is. Then that's something that would definitely would be in consultation with the physician who oversees the isolation unit, in consultation with her oncologist. And then it's a matter of how to provide her the services without exposing others. Because again, I don't know, does it require her chemo? Does it require radiation? There's the different forms of treatment. And so that would be something that I would defer to the medical experts. Since I'm not the physician, again, it would be between her
Right.
oncologist and our doctor who oversees the isolation
Right.
unit would discuss that amongst themselves.
Status. Oh, go ahead.
No, I was going to ask, what is the average wait time then for when public health receives a confirmation of a COVID positive? How long does it take for contact tracers to contact close contacts?
So we do have a backlog, because again, we've as Dr. Ann said, we've just started hiring additional support. So we've changed some internal processes so that we can try and ensure the individual knows that they're positive. Because again, we cannot tell the person they're positive. It has to be the provider who ordered it. We give a time of, trying to improve our timing of within 1 hour of getting a positive result through the lab, the provider who ordered the test would notify the patient. Then that in the reporting source would notify public health that they've already told the patient of their positive result. And so within another hour, public health would be contacting the individual saying, are you aware of your results? If so, then they will now initiate the isolation and investigation procedure, because that's something we've been working on with the CDC deployment team to reduce the number of calls to a new positive. And so that we can assess their house. Are they able to properly isolate at home? Are there any other high-risk individuals in the house, so that they can be quarantined and notified, and that they can start, again, self-quarantining, self-isolation until the next team comes in and calls, which is my contact tracing team. So sometimes there is a few days between that, but we've been working with the providers that educate the individual. Once you tell them they're positive, these are the necessary steps to self-isolate and tell their household contacts to quarantine, which is the most important thing to kind of stop the ongoing exposure, right? And then our team will come in to interview and to schedule for contact tracing. So already that within the first day, and again, timing depending on tests are being run through the night. We have the hospitals that are still conducting tests. Public health, we are not 24/7. So, if something comes in late night, early morning, then when our staff come in the morning, then that's when they initiate the calls for the new positive. And then again, it's a matter of getting the close contacts identified, getting the information, and then getting their contact information. So it's kind of that step process that we've been trying to improve on.
So you're saying the backlog is like a couple of days, but in the interim,
couple of days,
right.
because
in the interim, you're
we've been
letting
consistently still seeing double digits every day. Even though our number of cases are going down, we are still been getting double digits. We've had no relief. So that's why now, we've been getting more staff to help us. We also, just last week, we launched with University of Guam, their contact tracing team. They like to call it an extension of public health, and which is what we need. We need more help because again, as we get double digits being reported to us every day that are new cases, we still have to weed out, are they contacts from home? Are they contacts from work? And then who are their contacts now? Because now it spreads out to the next layer, right? It's like a spider web, or I don't know, just layer upon layer that we keep branching outward as we get new positives. And if someone has been going around while they're symptomatic, even though they went to get a test, and it goes back to, this fines, that's been our challenge. People have been going around while they're sick, not just to work. They went to go visit people. They went to a party or something. And so that causes a more complicated investigation and contact tracing, because now we're asking you were sick for 5 days. So I need to ask you 2 days before you got sick, where were you at? Because that's the start of the infectious period. And so if you've been going around for those 5 to 7 days while you were symptomatic, every day now the team has to look at where were you, who were you in contact with, do you have their information? We have to work with them to assure them we won't give out your name, but we need to inform them that they were exposed. And so that's something to the trust that we have to build with the new cases and the contacts, that they're not in trouble. We're just trying to help them notify the person, because what if they are also positive and they're going around and not knowing that, because they're asymptomatic. And so that's what we've been seeing these past few months, is people letting down their guard, not practicing the social distancing. I mean, we've seen, stores are opening up. The line is so long, but there was no 6 feet spacing between these customers waiting to get into that store. We've heard of reports of someone reported that a bar was operating. They went to check. The bar wasn't open, but they were having a private party. So again, that just adds more complications. So unfortunately, maybe the fines have to be put in place, and like Dr. Ann said, but do it properly, right? Because again, we don't want to punish those who are in compliance, were by themselves, or just within their household unit. But unfortunately, we need to probably set example for those who are not complying,
Right.
who are knowingly violating, all the information we put out from the beginning.
Yeah.
All the social distancing, all the executive orders, all the public health guidance. Because again, public health cannot do this alone.
Right.
We can do our part, but again, it's a community-wide effort.
Yeah.
I feel you, Annette. I feel you. I know you guys are working hard. I know that these people are crapping on this response, but it's good to get you guys in here and to get it from your side because it is a public health emergency. Okay, it's not a physicians advisory group emergency. It's not a Governor Lulian Guerrero emergency. It's a public health emergency, and you guys are public health, so we definitely appreciate your insight. Talk about Halloween heroes. Dr. Ann, I want to bring you on. You maybe close it out here as we're against the top of the hour.
Well, stay home if you're sick. That's the old, used to always, one of my pet peeves is like, what are you doing at work when you're sick? Even if you have a cold, you're going to spread it. Stop doing that. Follow the rules, hunker down. This is not over. And again, what don't people understand? It's a pandemic. It's global. It's surging everywhere. And of course, we're seeing the surge. We're still seeing deaths. We're still seeing double digits. And in terms of the rate per our population, we're higher than Hawaii. It's ridiculous. So this is a public health message. Sorry to be the bad guys, but this is a pandemic. We're not making this up. And, I'm tired of seeing it. I have COVID fatigue. I don't want to look at these deaths. I don't want to look at the death certificates. I'd rather see somebody die of something normal than COVID. And we are going to have some more data in the next couple of weeks, and we've got more help. So maybe we can get on top of this a little bit more at public health, but the community does have to do its job. We have to engage the community. We have to educate the community, and the community needs to respond. This is not a normal situation, and it's not going away anytime soon. I don't care whether they're predicting we're going to have a vaccine in 2 weeks. We're not. It's probably in spring. And then there's other things we have to deal with. We still have high STD rates. We have other communicable diseases that are problematic for our community that we have to address, as well as COVID. So, and if you're elderly and you need to be seen, go get seen by a doctor. And if you have weird symptoms, especially if you have chronic conditions, go get seen. We still have medical professionals, even though they're burnout too. You need to be seen by a doctor, go get seen by a doctor. And the rest of you, stay home if you're sick and forget the parties for now. This isn't over. We are community. Let's pull together and stop this.
Thank you, Doc.
That's it from me.
Right
Thank
on.
you.
Mic drop. Mic drop.
Thank
Mic
you.
drop.
Annette?
I don't think I can top that.
Yeah, I know, and that's why you're not going to.
She's like Dr. Pobutsky
Yeah.
out.
Yeah.
No, yeah, okay,
Thug life.
real.
Hey, we need that thug life with Dr. Ann
Yeah.
and the shades and the joint under my
Yeah. No, yeah, okay, no, real. Because real quick, I know we're cutting it close, but it seems like what Dr. Ann is saying, and it's absolutely true, is the the problem with the pandemic is of societal greed.
Yeah.
People just don't want to do what's right for everybody else. And I know this is probably never going to happen, but rather than imposing fines, what if we just give everybody a bonus if they stay home?
Oh, wow.
You stay home for
Now
2
we're-
weeks, you get
now we're
$1,000.
Now we're talking,
Because
Jay.
now it plays up to greed, and so greed cancels greed.
There you go.
All right, okay. That's my friend
I
Jason.
like that.
Yeah.
Reverse psychology. Give
Ah.
the
Exactly.
incentive to stay home.
But hey, I don't have the money to pay it out, so let somebody else figure that part out.
Thank you, Annette.
Get
Thank
free turkeys for Thanksgiving if you stay home.
Right.
There you go.
Hey, there you
Keep
go.
it in your house.
Thank you, Dr. Ann. Thank you, Annette.
Thank you.
God bless you guys and the work you
Thank
do.
you.
Oh, last
Stay
question.
safe.
Sorry, the testing that was scheduled for tomorrow, has that already been postponed because of the weather?
That announcement will come out later. I know
Okay.
there's still decisions, and tracking it, but the formal announcement will come out whether they're
Okay.
going to postpone it.
Okay.
Okay. Thank you, Annette. Dr. Ann, be safe.
Thank you.
What do we got, Jay,
Thank
for
you.
the
You guys be
ladies?
safe too.
What do
We got virtual shrimp patties that we've made.
Ooh.
Halloween special.
Oh yeah.
Yeah. Okay. It's good to
Nice,
eat
thank
fried in the
you.
morning. You work it off the whole day. Thank you guys. All right. See you. There you go. Annette Ogden and Dr. Ann Pobutsky, Public Health Shining Stars here. That's what they should change it. It's DPHSS. They should change it to Department of Public Health Shining Stars.
You're a shining star, no matter who you are.
Wow.
Shining bright, you see. DPHSS. No, that doesn't even rhyme.
It doesn't have to rhyme.
Yeah, there you go.
Hey, it's 8:03 to our viewers on KUAM TV.